Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is the second part of my video post about the patient who, or rather the individual who had contacted me via Instagram, just asking about possible underlying causes of allergic skin reactions, hypersensitive skin reactions that seem to be coming on with no obvious rhyme or reason. So I mentioned some of the underlying factors that could be afoot in part one, of course, which would be mostly around mast cell activation syndrome, or MCAS. I also mentioned that, of course, it's something that needs to be worked up by a clinician. There's too many little nuances and factors that might be afoot that might it's something that really needs to be worked up by someone who knows what they're talking about. So in addition to mast cell activation syndrome, underlying issues or factors being possible culprits, the other thing to consider would be if there might be a histamine intolerance component going on. So histamine intolerance and MCAS, they have a lot of things in common. I mean, the main thing in common would be that it's a histamine issue, but the difference, to my understanding, is that with histamine intolerance, it's that for some reason the body is just less tolerant to too much histamine, or maybe even what would be normal amounts of histamine for the average person. For some people, it might be way too much. So in those cases, looking to see if there are a lot of high histamine foods in someone's diet, and then possibly minimizing those would be something worth having on the DDX list or the potential future plan. In my experience, sometimes going on a lower histamine diet can be just pivotal and game-changing for patients who are having a lot of what seem to be histamine-related issues. And sometimes patients are just living on high histamine foods. It's nothing but citrus fruits and cashews or walnuts. They're eating a lot of fermented foods, bone broth. They might be eating a lot of avocados, which are quite in vogue, as they have been for quite some time. Tomatoes would be another big culprit. Cocoa-containing products like chocolate would be another potential culprit. And then there's other foods as well. So if there was a lot of high histamine foods, then that could be something worth considering exploring, maybe mitigating some of those temporarily and seeing if there's an improvement. The other thing that falls under that histamine intolerance category, assuming that things that might be driving mast cell activation syndrome have been ruled out, would be, is there an underlying sort of physiological difficulty metabolizing histamine? So that starts getting into the wild and wacky world of nutrigenomics, or some people call it methylation cycle testing, that type of thing. And so if people have certain differences in their ability to regulate if they have certain differences in the genetic integrity of certain genes that code for the enzymes that metabolize histamine, then that can cause problems. So, for example, if there are significant mutations in the histamine N-methyltransferase gene, also known as HNMT, and or the monoamine oxidase genes or the aldehyde dehydrogenase genes, well, those three genes code for enzymes that in that sequence of steps are, to my understanding, the biggest metabolizers of histamine in the body. And so if there's issues with one or more of those genes, then there might be a higher predisposition of backlogging histamine in the system, and then you're going to see histamine intolerance issues. Like, I'm getting normal amounts of histamine exposure either through diet or the histamine that's produced in the face of stress, or what have you, but or maybe there is a bit of ambient mold exposure, like there kind of is, it seems, if you live anywhere on planet Earth, and I can't metabolize that histamine optimally, so it backlogs and I get some type of a higher histamine type symptom, like skin reactions. So in that type of case, then by doing a nutrigenomic profile, or a genomic profile rather, then we can see, are there mutations, and then if so, we can't do anything to fix the genes, unfortunately, but we can certainly support the body with the cofactors that are necessary to help those enzymes work as well as possible. And so in that cascade, that would be things like methylfolate, methyl B12, S-adenosylmethionine, methionine. It would be things like zinc. It would be things like vitamin C, be things like vitamin B2, and then there's other histamine breakdown pathways like diamine oxidase, and oh my goodness, the B5 dependent pathway that I'm embarrassingly blanking on right now. Oh my goodness. Anyways, there's another B5 dependent pathway that I'm blanking on. So there's other pathways as well, but what it comes down to is it's an acetylation pathway. There's just a different name for it now, and I can't remember off the top of my head. Supporting the histamine metabolism pathways nutritionally with supplements or whatnot can sometimes be really useful at helping to get those histamine symptoms under control. And granted, that's going to be a little bit more of a Band-Aid type solution because really at the end of the day, one should find out, well, if it is a histamine intolerance issue, then well, we're going to have to do things to try to minimize that histamine exposure, and then using those supplements would probably not really be necessary down the road. But it's something that in the short term, at least to get symptoms under control, can be very important to basically figure out if symptoms start to improve, then we can have a better sense of what's actually maybe driving that in terms of like whether it is more of a genetic predisposition or metabolism type issue of histamine. So those are a few thoughts to think about, and there are certainly other factors that can be at play. Another one that's sometimes more prevalent in patients who might be on the more stressed or anxious or like alpha sympathetic dominant / type A personality spectrum. They might have more of something called an amygdala dysfunction going on, which I've been planning to post a video about and haven't got there yet. So that's something that can be really, really important. I've had patients who are incredibly reactive to everything, it seems, like supplements, food, etc. And once they get their amygdala on track, then it can be just a night and day difference, like going from I can eat 3 foods without reacting to I can eat pretty much anything except for, say, gluten and sugar, and I do okay. So I'll post about that into the future, or in the future. But for now, those are my immediate thoughts about hyperreactive skin issues.